So you're diligent about applying eye creams, wrinkle creams, masks, moisturizers, and all that kind of stuff, yet your skin still looks drab and dull. If this sounds familiar, our next guest says what you might need is a skincare line designed especially for you. Dr. Beth Collins joins me now, along with her aesthetician, Laura Brereton. Nice to have you ladies here.
Thank you.
Thank you. And you brought all your products. We'll get to it in just a moment. But doctor, explain to me why this is much better than something you would find in a drugstore.
Well, in a drugstore, even at the cosmetic counters and some other places, because in this line we have prescription grade medications, essentially. And when you find something in the drugstore that says, say, has retinol in it, the only requirement, they put a drop of the retinol in, so you have no idea what you're getting. With our line, there's very defined amounts, and then we're going to be following you with it, so it makes it a little bit more tailored to you and your specific needs.
And when we were chatting before, you actually met with a chemist who helped you design the products.
Right, this brilliant chemist did his PhD at Yale, and when I met him, he started talking to me about the chemical structures of all the products that were in the skincare line, and I was actually mesmerized. It was, I joked with him, it was the first time I could really pay attention to chemistry and really be interested in it. And so we came up with this line, and the thing that I love about it is there are some specific products here that Laura will get into a little bit more, but she is also able to compound a skincare specifically made for a patient. So she'll be able to look at somebody, talk to them about what their goals are, what their skin type is, and be able to actually make something that caters really specifically to them. And then we will follow that person to make sure it's working and doing the right things, or we may need to back off on something. And you see real results. People are very, very happy with the results of this.
And Laura, why don't you explain to us some of the products that you do offer?
Well, we offer 3 different types of cleansers and a variety of different sunscreens, supplements for the skin, retinoids. As Beth just said, we can tailor make a cream. Add different percentages of retinol and hydroquinone to, say, target pigmentation in the skin, different fine lines, wrinkles, anything that might concern our clients.
And run me through the process. A new patient comes to you and they're looking for this skincare. How do you kind of determine what they need, what they don't need?
Well, we talk to them first.
It's a good start.
Figure out what it is they're looking to achieve. What's their end game? What do they want to do? It can go hand in hand with things that Beth do in her office and as well as in my facial room with different peels, facial treatments, and then we can send them home with things that will further that.
Laura's even helped me out. I had some pigmentation problems, and so I said, Laura, I need something to fix these brown spots on my forehead. And so she'll talk to me about it. Well, what happens when you wash your face? Do you dry out easily? Do you get irritated easily? Which I don't. So she was able to make a night cream for me that had a high dose of retinol, which is really good for your skin, and I can tolerate it, whereas somebody else who has sensitive skin may not. And so she put in the hydroquinone in there with the retinol, and then a day cream to complement it. So I have my little set that she made.
It's fantastic, made just for you.
Just for me.
When you do these personalized products, there's a pyramid you kind of follow. In fact, let's put the graphic up, and Laura, we'll start from the bottom. If you could kind of explain what we're looking at and why it's a necessity.
Protection, the most important thing we can do for our skin, and it needs to be done 12 months a year, not just when you're out in the sun or going to the beach. It needs to be done every day.
Lather sunblock on, or do you find it in a moisturizer?
Yes, we have wonderful moisturizers that also have wonderful skincare in them, but you're getting a 30 SPF as well, and that needs to, I feel it needs to be done every day.
Really?
12 months a year.
Okay, and Doctor, you've mentioned it before, retinoids. What is that?
Well, they're vitamin A derivatives, and that is really, I think everybody should be on some sort of retinoid in their skin. It really does not only turn back signs of aging, but prevents a lot of signs of aging. And we see that with studies using biopsy specimens after somebody's been using a retinoid for a long time. It helps rebuild collagen. What we see is as you get older, the collagen in your skin and the elastic fibers get very disorganized and tangled. The retinoids, we see it under the microscope when we take biopsies, helps it get back to that normal lamellar pattern where things are nice and smooth. And that shows up as a decrease in the lines and wrinkles, makes your pore size smaller. increases the turnover time of your skin cells so that it helps you have a shinier look. So it's really
seems
the
magical,
one thing.
actually.
It is. It was initially brought around for people who had acne, and what they were finding was that their skin overall looked better, but they were also aging better. They didn't get as many fine lines and wrinkles because I think it's because of the collagen, and so it's basically the cornerstone of everything.
It's where you start, more or less.
It is.
And going back to their pyramid, there were hydroxy acids and antioxidants, but the top level are supplements. Are we talking vitamins, or what are we dealing with there?
Not exactly, no. We're
Okay.
talking about the different treatments that we have. A lot of them has to do with vitamin C in the skin, things that lighten and brighten the skin and help enhance it.
Very
so
good.
it's, I mean, supplements are
All
good
different
as well,
types of
but
supplements, right?
This is topical. yes.
Topical, very good. Okay, well, let's put the information up. If you'd like to visit Dr. Beth Collins, MD, you could visit her at her website, bethcollinsmd.com, or call 203-689-5295. Ladies, thanks so much for the advice.
Thank you.
All right, when Connecticut Style returns, we're heading over to the kitchen. We're celebrating a golden birthday. We'll explain after the break.